Now, this story leads. South Africa has recorded 9,445 new COVID-19 cases in the last 24-hour cycle, increasing the total number of infections in the country since the coronavirus outbreak to 921,922. The country is currently seeing a resurgence in the number of infections. The national death toll has ticked up to 24,691 after 152 new deaths were reported. South Africa has recorded 793,914 recoveries thus far. At the same time, over 6 million tests have been conducted in the country. 40,466 people were tested since the release of the last report. Authorities are urging all South Africans to continue wearing masks, practice social distancing and regular hand washing. Now, for the latest on COVID-19 in South Africa, I'm joined via Zoom by the Chief Executive Officer at Proactive Health Solutions, Dr. Fundile Nyati. Dr. Nyati, it's always good to have you on the show. A very good evening to you. Welcome to the Globe.
Good evening to you and good evening to your listeners.
Dr. Nyati, as though the second wave wasn't enough here in South Africa, there's now talk of a new variant of this particular coronavirus. And even though there's a bit of contestation of whether it is a total or rather a totally different new strain of the virus, but whatever the case is, Dr. Nyati, it has driven people to panic. So is it really a reason to be concerned?
Well, you are right. On Friday, the minister, together with his technical team, top experts in the country, they informed us that we're still dealing with the same, SARS-CoV-2 virus. However, there is a slight variation. There is a new variant of the same virus that has been discovered since the middle of October. And it is now becoming the, predominant, variant that is circulating in the country. Yes, we've got reasons to worry because it has started to show that it behaves slightly differently from the one that was affecting us during the first wave. And the difference here is that it has been found to be much more infectious, that is, a spread from one person to the other. It's much more than the first one. However, what has not yet been established is whether it actually causes a much more severe illness or not. Although some people, there is some anecdotal evidence that it seems to be, proceeding faster. But from a scientific point of view, it has not yet been proved to be more aggressive, but it's definitely more infectious.
We've seen travel ban being issued against the United Kingdom because of this new variant being getting out of control. Should we use, what's happening in the United Kingdom as a barometer of how we should deal with this new strain or with this new variant?
Well, I think we have already seen, since the first wave, that countries during times like these, they tend to look at the interests of their own, citizens. Yes, we are seeing a number of countries from Europe that are starting to ban travel from the UK. In fact, I think there's one or two, I think Germany, I can't remember the other one, that are also considering putting a similar ban against, South Africa, because we have now communicated that we've got this new variant that seems to be much more infectious than the previous ones. And so they want to limit the possibility of them getting, that variant. In fact, the variant that has been found here and the variant that has been found in the UK, the scientists told us that they are very, very, very similar, in terms of the kind of mutations that have taken place. So, yes, I think it is something that we can't avoid because everybody is looking at, how do you protect your own citizens, which is the primary responsibility of any country.
Now, we've seen clinicians providing us with anecdotal evidence in the entire epidemiological picture, and we've seen younger patients, Dr. Nyati, with no commodities or rather comorbidities being afflicted with critical illness. So it does appear then that it is a totally different, strain or variant.
Well, like I said, it's still the same, germ, but there's been mutations, and these mutations have made it much more infectious, scientifically not yet proven to be much more aggressive, but anecdotal evidence, like you've just said, it seems to be progressing faster to severe illness. It seems to be affecting people that were initially thought to be, less, vulnerable to this kind of infection, meaning the younger people, people with no comorbid disorders. So yes, we've got reason to worry, but unfortunately, to prove some of these things takes a bit of time. So, which is why the minister and his team said, people must take greater care to make sure that they don't get exposed to this new variant, which, by the way, although it seems to have started around the Nelson Mandela Bay in the Eastern Cape, it has now spread through, all the provinces of South Africa. It is now the major circulating variant of this, SARS-CoV-2 virus in South Africa. And so no province is immune from this. And we are seeing a surge in a place like the Western Cape, for example. During the first wave, they had, they had numbers of around 25, cases per 100,000. Now they have surged to almost 40 per 100,000. So they are reaching peaks that they did not reach in the first wave. And again, we are seeing a similar picture, in other provinces as well. The Eastern Cape as well. KZN and GP are not yet at that level. But what we are seeing is that no province is going to be spared of the rapid increase of infections from this new variant.
We're currently sitting at north of 24,000 deaths here in South Africa, and that is, accounting for about 40% of all coronavirus-related deaths on the continent. So what would you attribute this to? Could it perhaps be, I would say, a higher proportion of the population being over the age of 65 and thus more at risk of severe complications?
Well, I think there are a number of variances. There are a number of reasons, and I will actually attribute it, and what I'm going to say may not make a number of people happy, especially those who are in charge of the public healthcare system. What COVID-19 has done is to expose the inequities in the public health system, or in the healthcare system in South Africa. But more importantly, in terms of the quality of the services delivered in the respective provinces. And those people who are my friends on Facebook, they will know that for the last week, I've been making a lot of noise about the fact that my home province of the Eastern Cape is actually taking a big knock as far as the deaths are concerned. It's the only province that, up to date, has lost about 6,000 plus, people, as compared to, for example, Gauteng, which has lost just over 5,000. So there's almost 1,000 difference between, Gauteng and Western Cape, which is another one that's highly affected. It beats that by almost 700,000. But when you look at the populations, Eastern Cape is about 7-8 million people, compared to Gauteng with about 15 million people. But when you look at the death toll, it's so much higher. So the quality of the infrastructure, the shortage of critical, basic and critical equipment, shortage of ICU beds, shortage of critical things like, the ventilators, high pressure, oxygen supply machines, and all of that. So for me, the biggest issue is the fact that this pandemic is exposing the serious differentials and weaknesses in the healthcare system that is supporting the majority of the people. And those provinces with better, infrastructure like the Western Cape, as much as their numbers are quite high, but when you look at their deaths are not so, high. I mean, if we look at the deaths, that have just been announced today, Western Cape had about 30 deaths as compared to 105 from the Eastern Cape, which is about 70% of the 152 deaths that were announced overnight. So we are actually seeing a situation where the quality of the infrastructure, the equipment, staffing, and all the things that are needed to deliver a quality service is actually a determinant more than just, the people. Yes, I mean, we've got old people in every province, but the biggest differentiator is the quality of the services that are delivered, by the respective provinces. And those that are better off have got less deaths compared to those like the Eastern Cape that are actually seriously, challenged.
Dr. Nyati, there's a huge and a thick cloud of uncertainty here in South Africa as we are already in the second wave, and now we've been hit by these new variants. So should this change the way of how the authorities tackle the coronavirus moving forward? I mean, as we are we're almost about 2 weeks into the new year. Because remember, when the pandemic started, the reasonable expectation was that perhaps by January next year, then things would have perhaps normalized. But then it doesn't look like it'll be the case. I mean, we speak of the reopening of schools. Should the authorities change the way of how that particular aspect should be tackled?
Well, I think, when one looks at really, the only tool that medical science has against this, pandemic or this virus is actually vaccination. All right. But we know that that will not happen in South Africa, before June. I do not see it happening before June. There's a lot of administrative processes, from the regulator and the planning and everything. I don't see that happening. So I think what we need to do as a country is to double our efforts in educating our people, regular information sharing, because, we know that knowledge doesn't always, translate to change in behavior and change in practices. So we need regular, intense public health education programs in every corner of this country, because through that, we will manage to change, because there's a lot of people who think that, this, pandemic is gone, yet we are seeing the high numbers. So for me, the thing that the government has to, change is to double up in the public health education, use, things like radio, community radio, regional radios, use information in vernacular, because again, we tend to speak a lot in English, and not everybody is comfortable, to understand things in English.
Yes.
We need to enforce the regulations. Something I saw in Sweden about a week or two ago in Port Elizabeth. We need that kind of thing where people are breaking the regulations. There is a consequence for that. As far as schools are concerned, the Minister of Education announced that they will be stepping up on what they have been doing to try and mitigate the impact of COVID-19 in the schools. I don't think they need to change the calendar year when it starts. However, they should be using this time to make sure that there's more teaching of the relevant people, the teachers around this particular pandemic. For those with comorbidities, to be better protected, and also to make sure that the supplies to ensure that the people in the schools, in the circuit offices, in the district offices, in the provincial offices are actually protected. So issues of occupational health and safety have to be prioritized, because most public most government departments have not really, stepped up in the area of improving occupational health and safety as it is expected in terms of the Occupational Health and Safety Act of 1993. So those are the things that I think need to be done, but I don't think they need to change, when it starts, because it won't, really impact. Let's just empower the people. Let's make sure that what they need to prevent infections at schools is actually, made available. We shouldn't have schools that don't have, sanitizers, the mask and things like that. So that's what I think should be done.
All right, great chatting to you.
The education department has lost almost 1,500 teachers, 1493 teachers, by the time the school year ended. We need to save those lives, and we can only do that by ensuring that people are empowered to take care of themselves.
Indeed, Dr. Nyati. I mean, as people will be hosting parties now as we are well into the festive season, we certainly cannot overemphasize the need and the importance of wearing masks and following all the non-pharmaceutical protocols, to, avert the crisis. Thank you so much for joining us.
All right. Thank you very much.
All right, that was the Chief Executive Officer at Proactive Health Solutions, Dr. Fundile Nyati. He is, a medical expert, and he's been busting those myths around coronavirus.